Good evening, everyone. Welcome to the Doctors in the House Health Show on 99.1 FM, WUJM, St. Petersburg Community Radio. We have an excellent program for you tonight. Please stay tuned. Hello. Good evening, everyone. Welcome to Doctors in the House, your health show. I am Dr. Morency, your host. You're listening to 99.1 FM, WUGM, St. Petersburg Community Radio. For those of you online, WBU99GemsTheBurg.com, welcome as well. And I would love for you to give some calls if you can. The number is 727-637-2416. Now, the topic today is this. Is it the blues or is it major depression? How can you tell? Can you tell? So this is not the first time in this program that we've talked about depression, mental illness, quite a few times as a matter of fact. But today I am going to approach it from a different angle, okay, with a different emphasis. This time I really want to talk to you directly. Talk to all of you who have been suffering with some kind of mood disorder that is undiagnosed. And all of you may not know, may not be sure about what the problems are, but you know there's something wrong. I want to reach out to you. I am not giving you a lecture. I want to talk to you. All of you. And perhaps you've been to the doctor many times for a variety of vague physical complaint or some complaint. Some of them, fatigue, chronic pain, headache, dizziness. And you've had a battery of testing, but nothing showed up. I think that's patient doesn't like to hear that. Everything is negative. Everything is all right. But how come I don't feel well? I know there's a silent majority out there who have had that burden of, I don't feel well, but nobody can find anything. And I don't want to be bothered anybody anymore. Listen, folks, I'm very familiar with this. I'm familiar with you. I've been a family doctor for 35 years, and I have seen and treated so many of you who suffer from some kind of mood disorder, primarily depression, anxiety, and there's no answer. And the reasons are complex. You see, unfortunately, the prevalence, over the last 10, 15 years, the number of folks who have been suffering and diagnosed with depressions have increased to an epidemic level. And there is no demographic group has been able to escape this increase. Men, women, young people, old age folks, nobody's been spared. Now, young adult, for the past decade, young adult and adolescent topped the list, and even worse, have been on top of the list for kids with depressions who attempted suicide or committed suicide. And children as young as 3 years old have been found to suffer from depression. Can you believe that? And the sad fact about it is that 2/3 of people with the diagnosis of depression have been found to, successfully committed suicide. And this is not necessarily a good thing. These are children here, our young folks here. And those data telling us about the increase of depressions were published before COVID-19. So you can imagine what's happening now that we are a year into this pandemic. So if you look at the statistic from the World Health Organization, depression worldwide is the leading cause of disability around the world. And suicide, according to CDC, has made the list of the top 10 cause of death since 2018. Actually, it's the 10th cause of death suicide. So what I want to do today, I want to kind of ask you to hang in there for the next 25, 30 minutes. Pay some attention. Because at the end of this talk, I really want you to be able to tell the difference between the normal ups and downs of living, or what we call the blues, and this terrible disease called major depression. So, what's your idea of depression? What is depression? You've heard about it, and I think at some point everybody's been talking about it. And recently, because of COVID, there's an epidemic of depression worse than before. Every country, Europe, obviously the United States, Japan, India, all those places who may have had a low level of depression are going through this stuff because there's so much thing going on. And I wish I could talk to you because I want to know how does it feel to be depressed, okay? And for how long? What's going on? Well, I have a really different way of putting it, okay? Because I've been thinking about this. I've talked about depression before. When I look at depressions, I think of small d and big D. Now, when it comes to small d, everyone get depressed once in a while, okay? And some of the symptoms may be different. Maybe they're actually the same with the symptom of the blues and as those as the other big D, major depression. It comes and goes. Life itself, life problem can trigger depression. Being fired from your job, getting divorced, losing a loved one, so on and so forth. Those are the drama of life. Financial trouble. All those things can get us down. Sometimes for a couple of days, but it doesn't. It goes and come back because it has to do with our ego. When we associate so closely with what we do, if something happen, we feel it. All right. And now with COVID, just imagine for a majority of people, living has become kind of unbearable. It's a matter of survival because society is breaking down because of COVID. All right. People are grieving. We got over 500,000 people dead, and they die in conditions that we never used before. People die in loneliness. They cannot share this special moment with their loved one. Lots of people have lost their job. Their business may not come back. People are feeling totally isolated because of whatever measure we have to take to protect ourselves. Nobody likes to be locked down or just wearing a mask, and we can see that. Cannot hug your friend or shake hands and do the thing that we used to do. So you can imagine how easy it is if you are anybody, so you want to deny the whole thing. It doesn't exist. I don't be bothered with this stuff, okay? So those life events and stress, we call them, can bring on feeling of sadness, anxiety, anger, and depressions, and make those disorders very hard to manage. But here's the thing. This is the point I want to get through, okay? A lot of people go through this. They are able to cope with the stress, okay? They get knocked down, but they get up, all right? And this is what I call that, those are the fact of life. We have to go through, it's not a sunny day every day. There are, cloudy, rain and storm. We get up, okay? So this is what I define by small d. As opposed to when you have those symptoms every single day, and then we'll talk about the specific symptoms, every single day, feeling blue, anxious, angry, cannot sleep, stressed out, when you have those symptoms every single day, days in and day out, at least for 2 weeks, there's something different. It's not the usual thing. Okay? At the same token, you have those symptoms that last 2 weeks at least, and then you are not able to cope. You are unable to fulfill your daily activity, your job as a family man, as a father, a mother. You cannot go to work. You're isolating yourself. You don't want to deal with anything. There's a different flavor to this, especially if it lasts that long. And that's why I call Big D, because something else is new. We've crossed over from thing that you can recover from that doesn't affect you, stuff like that, and you go now to a territory where every day you're going through this and you may actually have some kind of disability because you cannot do anything. So that's the point where something else is different. All right. So this is Big D. So we're gonna move further into the definition of depressions. Okay. So far what we have symptoms that last every day at least for 2 weeks, symptoms that cause you to be totally disabled, not able to do anything. It may be serious, it may be mild, it may be in the middle, but certainly you cannot really carry on as you normally do. Okay. So that's why we define the Big D or MDD, major depressive disorder, as a psychological, social, biological, meaning that it's involved your cells in the body, your brain. That disorder, that problem can be episodic. Okay, you can have one episode of depression and never had anything like that, but it can also be chronic. You can have it for a couple of months and it goes away and then come back again, and some people have it for a long time. And it usually requires some form of intervention in order to manage it. Now, there are major type of depression, and I am not going to them because this major depressive disorder, MDD or Big D, really they have the same baseline symptom with added. For instance, if you talk about psychotic depression, those are somebody who have the same symptom of depression, but in addition, they have no connection with reality. They don't even know where they exist and what stuff. That's called psychotic depression. There's depression that has a lot of component of anxiety where you are afraid, you have all those things. So we're going to stick to depression, keep it simple because it's more common. That's the most common form of depression. So what is it that people feel? Then we get what is the symptoms of depression? Well, depression has a multitude of symptoms, a lot of them, and not everybody experiences depression the same way. Okay, because as a human being, we are influenced by our gender, by our race, by our culture. Where you're from, your ethnicity, your culture define how you manifest yourself with the depression. Okay, so however, this is the key. This is the fun. We talk about the duration. We talk about your capacity to functions. Okay, and we talk about all the symptoms. But there's something in common that really nail this, that really make that difference, whether or not you have major depression or not. Because of the diverse symptoms that you can experience. And let me go through them, okay? Persistent sadness, you're anxious, you're feeling empty, you cry all the time, you have no interest in pleasure, any activity, including sex. You eat too much, you put on weight, you have sleep problem, either you sleep too much or you don't sleep at all. The key, this next one, decreased energy, is very common. People wake up and said, I am so weak, I have no energy to do anything. You experience fatigue, you're feeling that you slow down, restlessness, irritability, excessive crying, guilt, worthlessness, helplessness, hopelessness, pessimism, difficulty concentrating, remembering, making decisions. And the big one, obviously, which always rang the alarm, if you're having thoughts of killing yourself, okay? Suicide ideation, we call it. So you see, you have a whole slew of symptoms, but you don't need all of this to make a diagnosis of depression, to know yourself where something is wrong. First, the symptoms, which could sound like the blues, lasting 2 weeks minimum every day. Doesn't go away, doesn't give you a break. there constantly. Number two, you may be able to function, but a lot of people cannot function because the way they feel. All right. And then you have this cocktail of symptoms. Now, here's the clincher. This is the final thing. Of all those symptoms, there are two of them that is kind of universal. Okay. The universal is that most people experience them. And the first one is if you lose any interest whatsoever in anything that give you pleasure in the past. Say you like sports, you used to go to sports, you used to play sport, and then all of a sudden you don't care. Okay, you used to go for a game with your folks, you like to go to party, even sex, you're not interested in sex. Okay, so it's called anhedonia, meaning lack of interest in any pleasurable activity. So that's one. That's a big one. The second one is most people who have the big D, the depression, have the depressed kind of mood for those 2 weeks or more. You know, they're low. They're sad. They just have there's no light, so to speak. So depressed mood and loss of interest in pleasurable activity. You need one of those to make it a full depression. And then of all the 100 millions else that I give you, if you have 5 of those added to the one of the 2 big one, that's called clinical depression. That's major depression. Okay? So that's how you can differentiate between the daily depressions we call the blue. You can be sad, angry, all the stuff which come and go. You recover from it, but they're not persistent. So once you have it with such a persistent, then you have the disability, and then you have one of the key big one, loss of interest in usual pleasurable activity that you used to have and you don't anymore. Or you have that depressed mood, sadness, the sky is gray every single day. And then either you have too much, you cannot concentrate, you cannot make decisions, you are thinking of hurting yourself, you have guilt, you feel worthless, hopelessness, pessimism. That added to that's the full picture. And the reason this is important is because we don't have a blood test that will give you a number to say, well, you are depressed. We don't have that. We don't have any x-rays. Now, we do have special imaging, MRI, functional MRI, special CAT scan, PET scan, that can give you an idea. But those things are they're not routine. And plus, they just give you a picture. They don't give you a number. Whereas, if you have hypertension, you know you're 150/90. If you have diabetes, your A1C is all over the place. Your fasting blood sugar is 200 instead of being 100. You have a number. If you have the thyroid problems, you have a number of your thyroid function. So that's clear, the diagnosis. And most people love their numbers. Okay, so when you go to somebody and they tell you, well, I think you have depression. You say, why am I depression? Well, you have depression because this is what you're telling me, and I'm asking you all kind of questions to see what is it. It's a physical evaluation, history, talking to you, get the stuff. So when you go to a doctor, please don't hide the fact that if you're feeling this way, don't hide it, because the doctor wants to know. Okay, now, what happened with depression, again, in addition to the psychological symptoms, emotional symptoms, you also have a lot of physical symptoms. And I've had a lot of patients who spend time, they come, the pain never goes away, the headache never goes away, they're dizzy, you do a battery of tests, but they never tell you, Doc, God, I am kind of depressed. That's a simple magic word you can tell the doctor. Or if you don't want to say that, said, man, I used to do this, I used to do that, I used to like it, but I don't go party anymore. I don't have sex with my spouse anymore. Then that will trigger the doctor to ask you more. And we have this questionnaire we give you, and then we calculate how much of those you have to give you the final response. Now, so in a sense, this is what I really wanted to convey, that you as a person, give you some clues, some idea whether when it's crossing over the line to the major depression, you can have an idea. So while I'm on that thing, let me give you a couple of things that makes it difficult. Because depression is so recent in terms of paying attention to it, because now we understand the brain get involved. There is a modulation of those chemicals called neuroreceptors which travel in the brain, whether they up or down. Those are associated with this. We know that there's some genetic factor that if you have depression in your family, you have 10-15% chance of having depression. We know now that there are a lot of medication whose side effect is depression. We know now if you have a childhood that was difficult, whether physical abuse, no love, no caring, sexual abuse, those things tend to carry over with you and put you at risk, so that the next time the wind blow and you go over. So now we know all this stuff, okay? So, having said all that, let me tell you what depression is not. Depression is not a sign of weakness. There's no such thing. It's not your fault. Nobody likes to just wake up and want to be depressed. No. It is not just in your head. As I told you, there are physical conditions, psychological conditions, physical symptoms that makes depression a real disease. And the only thing we are working on, we don't have a number to give you. I mean, we don't have a blood test, a blood number. But we have a number. When he asks you all those questions, we tabulate them. And if you score 20 when you're supposed to be 2, 3, then, that gives us an idea what you have depression, okay? Also, depression is not a normal part of life. The small d, yes, every day we go through nonsense, stress and difficult situation, money issue, family issue, fight. Those are life. Those are small d, but it doesn't make you suicidal. It doesn't make you want to stay home forever and not interacting with anybody. It doesn't want to make you decided you're not going to participate in anything that can give you some fun, because life is supposed to be so fun, okay? And and the other one that makes me funny is that only women get depressed. No, that's not true. Now, the woman has an advantage. They don't have any trouble going to the doctor and express their feeling, okay? Men do. Men don't want to say anything, because if they do, that will make them not appear masculine or strong, okay? So even though more women may have depression and may even think of suicide, they don't kill themselves as much as men. Men committed suicide successfully 4 times more than women, but more women have feeling of depression. So it's all those things. It is a big deal. Once you go to the big D, it's a big deal because it affects your life and you have no fun, you suffer. And if you listen to some of the symptoms that I talk about here, the hopelessness, pessimism, helplessness, who wants to live? Okay? Some of those symptoms can be so painful. That's why this idea come to you. Maybe I'm better off not having a life, because nobody wants to live under those conditions. Now, here's the good news. The good news, we're not 100 years ago when everybody, if they have major depression and they have all those symptoms, they locked them up because we didn't understand what depression was about. So the association that having depression and being crazy should be totally forgotten and forbidden. You are not crazy. You have actually a treatable condition, like if you had diabetes and hypertension. To tell you the truth, hypertension is probably more difficult to treat because you have no symptoms, and then until you wait for the stroke. But depression, you feel it. So don't live with it. Share it with your loved ones. Share it with a friend. Don't sit there and deny yourself the chance to really have a happy life. Now, this is a complicated thing, but I really want to focus on you knowing what the signs and symptoms are, so you can don't hide it. If you ever manage to have the courage to go to your doctor. By the way, you can go to your family, primary care physicians. I'm a family physician. I used to treat depression. A lot of primary care physicians can address the depression and can treat them themselves. It is simple, non-complicated, but they can refer you. They can be the source of referral if you don't know who to go through. They can refer you to a therapist. There are some great therapists out there. And so share, don't hide those feelings. Don't be embarrassed. Don't be ashamed. This is not your fault. Depression is actually real. Major depression is the most common form of mental illness. And the reason I'm keeping addressing it is because in spite of all this process, the education out there, and this time of with the COVID where everything is upside down, people who have any kind of risk factor can actually get depressed, okay, because you're at risk, and those stress can bring it on. So if you do certain, you talk to your friend, you talk to spouse, somebody who can listen to without judgment. If you have mild depression, you can actually feel better. The other thing you can do to feel better is, this is the first time where, because we talk about lifestyle for everything, but in depression, the article, the research have shown many years ago that simple thing, exercise. Actually, I don't want to say exercise because that frightens people. Walk. You don't have to run. You can. There's something about walk with your arm moving around and your balance that stimulate the brain so that you can avoid those negative bias. Because if left to ourselves, when we thinking about anything, it's never anything good. We think about bad stuff. Okay, and we may have plenty of good things in our life. So in terms of treatment, my message is to increase your awareness. I want every individual to be able to recognize when they go over to depression, not just feeling the blues, okay? Once you have the awareness, then you can think. Depression is serious, need to be treated, okay? And the other thing is, whatever negative emotion you're going through, certainly sometimes just having a conversations with somebody, okay? Don't hide it. Depression, somebody mentioned that when you have COVID, if you stay in bed, you have fever and stuff like that, COVID gonna take over. So you better, do some activity and do whatever. If you have depression and you're gonna listen to your depressed self, okay, you won't do anything. You gotta be proactive. You gotta, for instance, if you play the piano or I play the saxophone, my God, if I have some moody days and stuff like that, I go to my saxophone. I may not feel like it, but man, the minute I start playing a few tunes, I perk up. So you do what you have to do for this stuff. Now, if the depression is severe, I think it's really important to consult your physician or counselor and just make an appointment to see somebody, okay? Because once you get into the severity of depression, suicide is a problem. We have concern. So there's some numbers out there. There's a organization called Substance Abuse and Mental Health Service Administration, which is nationwide. It's a national helpline. Number is 1-800-662-4357. 1-800-662-4357. You can get information about where the support and treatment facility in your area is. They can conduct you to that. And there are some local hotline as well in your town. What happened when you don't treat depression before, other than having suicide? And you have a lot of things. There are a lot of people out there walking around with substance disorder, drug abuse, alcohol, anxiety. They don't care for themselves. They don't take care of their medical problem. You get into trouble, okay? So in summary, because the time is flying like I don't know, time fly anyway. Summaries. So depression is common, one of the most common mental illness. It is agonizing. Severe depression is agonizing. You don't want to feel that way. You don't want to live that way. And plus it can be deadly, okay? I mean, God, what's the name of the actor, funny comedian guy? I forget his name. Nobody knows this guy. The name escaped me. And then now you have COVID, right? Which make everything chaotic and suffering. And if you are at risk already, you are at risk to get depression. While anyone can go through some episode of depression in their life, there's a big difference between that and major depression. Major depression, I already mentioned the changes. It's constant, not intermittent, at least 2 weeks. Okay, you may actually have some disability. You have no loss of interest in anything, and you have a depressed mood, and you cannot, you may have sleep problem. It lists at least 5 of those symptoms that I mentioned to you. So now that you know, so pay attention to those. Pay attention when you lose interest to anything that you used to enjoy. Okay. Treatment options depend on the severity. As I said, the mild symptom can be managed with a solid support system and maximizing your lifetime. I call it SEEDS: sleep, exercise, diet, stress management. All those things can really help. And boy, having a good friend that listens to you without judgment is better yet. All right. And if there's any suicidal question at all and you need further therapy, please seek professional help, because there's a combination of medications and therapy that can really knock this thing out. Okay. You don't have to. And it's not in your head. It's not a weakness. It's not your fault. Ladies and gentlemen, I think I don't want to be giving you more information. I want to keep it simple. Persistent symptoms, lack of pleasure, depressed mood, and a combination of 5 others that we talked about. Having said that, I'm going to thank you. I really thank you for your attention. I hope you were listening. It's too bad I cannot call you to quiz you for this, but please give us a call, 727-637-2416 for some feedback. And it's possible that we can go to the next show or the next show on depression, pay more attention to the mild treatment management, how to deal with those toxic emotions. All right? Thank you.
This is Carafesta Radio. 99 Gems, The Berg.